wanted to make sure that we were creating an environment that looked welcoming and engaging, and we thought not to come.
Karen Sutton is giving a tour in the days before it will open.
Come up these steps, we'll have buzzed them in. And this is considered the quieter area, so let's say...
Sutton is the director of the Center for Diversion and Services, which will hopefully change the incarceration landscape in Metro Atlanta.
Anyone who comes here on a charge is completely diverted, but when they leave here, they're not leaving with a charge.
It was 2 years ago that Atlanta's Mayor Andre Dickens, along with law enforcement and local leaders, broke ground, so to speak, on the center, which was an unused separate space in the city's detention center. The goal was to tackle an issue that plagues local jails around the country. They are filled with people who are not dangerous criminals, but who are struggling with mental health, homelessness, or substance use. Many are repeatedly arrested for minor offenses like trespassing, loitering, shoplifting, or public intoxication, things that are symptoms of bigger unaddressed quality of life issues. Jails can worsen these issues instead of solving them.
We used to have a singular blunt instrument. 911, APD arrives. What's the problem? And that's the word that was used. There's this homeless guy. This person is panhandling. There's someone asleep behind my convenience store. And the police would do what they were trained to do, put on the handcuffs and take them to the only place they could take them, which is the county jail.
Fulton County Superior Court Judge Robert McBurney co-chairs the Justice Policy Board, which oversees the center, a partnership between the City of Atlanta, Fulton County, Grady Health System, Policing Alternatives and Diversion Initiative, and Georgia Justice Project.
The Diversion Center is a 24-hour, 7-day-a-week pre-arrest diversion drop-off center for law enforcement, which means this is a center that is only going to be utilized by law enforcement officers. So here we also have additional offices.
Instead of arresting people for nonviolent offenses, law enforcement can bring them to the center. People who come here are not charged with a crime and are referred to as guests and are greeted by certified peer specialists who have similar lived experience. They will have on-site access to an intake screening, a needs assessment, as well as mental health and substance use support. There are places to shower, wash their clothes, and get a hot meal. There's also assistance with housing and other essential social supports to move their lives forward. It's a respite from their challenges where they are treated with dignity and respect.
Jails have really become like de facto behavioral health centers because of these issues accompanied with the charge. Jail is where this population tends to end up, and needs are not met there. And what we also know is with this particular population that we are targeting, they linger in jail twice as long as someone else who may be facing the same charge.
Yeah, it's pretty cool. They have a lot of decent people there. It reminded me of like safety, I guess, being saved and having an option, like an alternative.
Alexandria Seeley and Trindlin Browning were the women Sutton toured through the center.
Yeah, it just would have been different. It would have been a lot easier.
Put in foster care in 3rd grade, Seeley aged out and was arrested 10 times over a number of years for shoplifting clothing and food. She wound up being sentenced to 5 years in prison and served 1 year.
And I was like, I need to like figure out how I'm gonna get money without going to jail. That was the hardest part. And where do I start? What does it look like? I didn't really have examples around me of being incarcerated and life after. You get emotional, I get emotional.
Seeley, who says she struggled with mental health issues growing up, was eventually diagnosed with bipolar disorder.
All right.
She is now the social media and engagement coordinator for Women on the Rise, a nonprofit led by formerly incarcerated women of color. Women on the Rise focuses on advocacy and support for women impacted by the criminal legal system.
I told my employer what I had done, and he decided to press charges.
Trindlin Browning was arrested for theft at her workplace.
I actually served a year at Whitworth Women's Facility. I was sentenced to a year, served 6 months. So I came home Thanksgiving Day of 2022.
Browning has received treatment for depression and now works at Women on the Rise.
I am the lead reentry specialist.
So now we're passing through what we would call the cafe.
So when Browning and Seeley were given a tour of the Center for Diversion and Services, they saw firsthand what had never been offered to them.
I think it could have saved me a lot of embarrassment, headache now, to be diverted completely from the judicial system, and to be, not just to be diverted from the judicial system, but to have a guided plan back to your normal.
It gives people a chance, provides hope.
Grady Health System is the operator of the center, and the goal is to decrease bookings at the jail and to connect people to resources. It's much costlier to incarcerate someone than it is to offer meaningful help. Diversion programs are growing across the country, reducing recidivism rates and showing success by connecting people to resources that make a difference.
We know that this particular population, people tend to shy away, don't engage in direct eye contact, make all kind of assumptions, and they clearly feel unwelcomed in many environments. And so we know that with the right degree of engagement, we know that change is possible. We are innovative, we're person-centered, we're engaging with guests where they are. We're not just hopeful, we know that this is gonna work.